So the question is, do we use a towel or do we use the body disc? You can use whatever you want, but if you use this towel, you can see it's tightly wound and it's give or take 6 inches long or so. That's going to cover most people's lumbar spine. Okay. If we put that underneath, if he rolls up and over, you can see that each vertebrae is going to have its day in the sun, and when it gets to this vertebrae, wherever you have pushed it, that's going to mobilize that segment. So if you're looking to mobilize a segment, and the therapist is saying, hey, we really want to mobilize L5, we want to mobilize L3 or 4, that's where you want to make sure that the therapist is showing you exactly where that is. Okay? If they are not telling you that, then maybe they're looking for more support, and then that would be something you would come to me with, because then they're giving you the wrong exercise to give them. If we put this underneath, let's say we're at L4 on him, and we have him do 1 o'clock and 7 o'clock, you can see he's mobilizing the right side more into flexion and the left side more into extension. Make sense? If we go the opposite direction, then it's the opposite. Don't live quite so high. That's way too high. There we go. Because we don't want the hamstrings and the glutes working. We just want the abdomen. Make sense?
So do we keep it straight across?
You can keep it straight across. You can also turn it diagonal, right? Depending on what your therapist is asking, because that's going to mobilize the segment that they want.
I've seen therapists roll it in like a spiral in the shape of like the Dynadisc. Is that appropriate too? Or?
Certainly.
Okay.
So if you don't have a Dynadisc at home, or the patient's like, you know what, I'd love to buy that, but I just don't have the money for it, you can create something like so. They lay on it as well. It will compress down with them. But just notice, this is much more aggressive height than the Dynadisc. So if you've got someone who has an unstable pelvis or an unstable SI joint, probably too much. And this is probably too much for them too. But okay. Excellent.